Awesome. Okay, well, my name is Mindy Dokas, and I work at USU's Institute for Disability Research, Policy, and Practice, also known as the IDRPP. And I would like to welcome all of you to the Pediatric Medical Shared Decision Making Frameworks for Families and Providers webinar, organized by the Multicultural Disability Network and Training, the MultiNet project. We seek community integration and inclusion of people with disabilities from multicultural backgrounds. The intersectionality of disability and diversity includes many factors such as race and ethnicity, age, rural and frontier geographies, gender and gender identification, health literacy, SES, among other cultural elements that creates a complex context that needs expanded conversations and learning opportunities, such as this webinar presentation. As part of MultiNet work, we have developed at the IDRPP other products that I invite you to look at in the link placed in the chat. I'll put that in the chat in a minute. Today, we have the privilege to have Jessie Allery, who is one of a team of trainees at the Utah Regional Leadership Education in Neurodevelopmental Disabilities. In this program, professional graduate students and community members are trained to move beyond discipline boundaries to provide optimal services to children with special healthcare needs within a family-centered, culturally responsive framework. Self-advocates and parents and guardians increase leadership and advocacy skills and provide invaluable insight there. And I will also link the website to URLEND is also what that is called. So I'll link that. And Jessie will be presenting about barriers and ways to overcome those barriers to increase communication around medical shared decision making. And today's webinar is geared towards families with children or youth with special healthcare needs who want to better advocate for their loved ones, working closely with healthcare providers. So before we get started, I wanted to just throw some ground rules out. So just first, keep your mic muted during the presentation. Remember that this webinar is here to discuss, not to debate or argue. Any discussion should be focused and avoid deviated conversation. Keep in mind and be open to learning something new. Please be respectful of others. Listening is as important as talking, and avoid making assumptions. And ask questions politely to gain understanding and clarity. And you'll see during the presentation when it's appropriate to ask questions. So with that, I pass it to you. Oh, wait, now I just messed that up. Okay, now go ahead.
Thank you so much, Mindy. And I am so happy to be here sharing this work with you. Like she said, we are talking about pediatric medical shared decision-making framework for families and providers. I am Jessie Allery. I am a board-certified behavior analyst who works doing applied behavior analysis here in North Dakota. I have experience as a special educator for 10.5 years and being an early interventionist for 3 years, working in homes with families for children under 3. So I'm happy to be here along with myself and my awesome team. We have created this presentation as part of URLEND. And because unfortunately not everyone was able to be here with me, but I would like to give a brief shout out to the rest of the team. So Emmie Gardner is a clinical social worker who has a plethora of experience working with families from diverse backgrounds, and especially working with palliative care. Riley Kerman is a special education PhD student. She is also a special education teacher. Elena Stam is an awesome audiologist out in Idaho and really gave a good perspective for working with families with children that have hearing loss. Abby Norton is a psychology doctoral student who statistical analysis was fantastic and definitely useful as we created this. And then Amy Reisner has worked in public health administration along with a plethora of experience from providing additional support in schools, in family homes, and in Special Olympics. So thank you to my team for creating this. And we'd also like to thank our awesome advisor from URLEND, Mr. Eduardo Ortiz. His support and guidance. Without, we could not have done this. And thank you to Utah's MultiNet network for having us today and for allowing us to present on this, and to the Family Health Information Centers who also allowed us to share some information with us. So the goal of this presentation is to provide a framework for providers and caregivers of children and youth with special healthcare needs to encourage shared decision-making and to move beyond a model of compliance, really to that model of collaboration. Our presentation objectives, we have 4 of them. So the first 2 include really working on communication and ways that promote that cultural curiosity. Now, we say culturally curious because no one can be completely culturally competent in absolutely every aspect, right? Culture is such a broad, vast term, and it is so intertwined with every family. And so we really just want to make sure that we can always stay curious about the families as providers, and that families are also curious and wanting to share with us so we can all learn and grow. Our second objective is to increase familiarity with circumstances. That just calls for, or that call for modified communication strategies, right? Whether that is diverse backgrounds, it could be low socioeconomic status, it could be limited literacy, or it could be that English is a second language, and so there's that language barrier. There's a lot of reasons that sometimes we would need some communication strategies, and so we're just going to cover some of those. Objective 3 is to increase awareness of common barriers. As providers, we really need to make sure that we are aware of what those barriers are and how we can support families in really helping to make that a common collaboration when we're talking about what can we do and how can we help to provide services and just to provide support in general. And objective 4 is minimizing obstacles and increasing family participation. If there is an obstacle in the way, whether that is a resource we need to learn how to provide or to look into providing, is it interpretation? What is it that we need to do to really make sure that families feel valued and are open to sharing? So the what and why of shared decision making. The Health Service and Resources Administration Maternal and Child Health Bureau identified 6 components of an effective system of care for children and youth with special health care needs. The 6 components of effective systems of care are: children are screened early and continuously for special health care needs. It's not just a one and done, it is a consistent check-in. How are things going? Making sure that nobody is missing anything. Families and children are partners in decision making. It is not just a provider says, you do this. That isn't helpful. You are their main advocate. You know your child best. We want to make sure that it's an equal partnership. There are community-based services and organized so that families can use them easily. So what are services in your area? How do you access those? Making sure that there are those services available. That children with special health care needs receive care in a medical home. Families have adequate insurance and funding to cover services. Unfortunately, we know that sometimes money is a barrier to medical care, and we want to make sure, are there options and are there ways to make sure that your child is getting everything that they possibly can, and that children and families receive services necessary to make the transitions to adult health care. When children are under the age of 18, it's a bit different, or when they can stay on family's insurance up until 23, 24. And then when you look at adulthood, that transition it's a big deal, and it sometimes can be very complicated. And so making sure that you're getting all the support as that happens. Research shows that only 14.4% of families of that are have children with special health care needs are receiving all 6 components. Healthcare systems should be prioritizing the measure of the quality of life and well-being for all aspects. You know, it's quality of life. We want to make sure that every aspect of what your child is going through, whether it's medically or service-wide, that they're able to participate as much as possible. So we want to make sure that we are thinking about their autonomy, that they have the right to say, no, I don't like this, their dignity, right? That they have the right to say, no, I do like this, or I don't. Independence, that we're thinking about their spirituality, their culture, and how does their culture and family play a role? Relationships, what relationships, whether it's siblings, parents, aunts, uncles, you know, who outsiders, who is important to them. Those coping skills, you know, having a medical or a child with medical heavy needs can be really exhausting. It can be frustrating. It can be really hard, right? There's not another better word than it's just hard. And so making sure that both the child and the family are able to have some of those coping skills and quality of caregiving. As family members, if you are pouring out everything you can to your child, that's great. But what happens if you have an empty cup, right? We can't pour from it from an empty cup. So what is it that we need to do to make sure that you're getting everything you need to continue to support your child? Navigating a family's life. Oofda, right? Sorry, that just sounded very North Dakotan. um, but families are a huge, intricate system, right? So it is not just mom, dad, aunt, uncle, grandma, right? There's a lot of things that go into it. School, there's a whole bunch of team members as a child goes to school. If you think about medical needs and healthcare, that's a whole giant team. If you think of just developmental assessments and learning, does my kid need an IEP? What are additional services that they need? Do they need outside speech or outside PT? That is a whole separate team. If we're looking at kids that are joining in sports, whether it's Special Olympics or adaptive sports, what does that look like? There's so many pieces, and I think this picture just does a great job of showing just how complicated and yet how intertwined it is. Like, the hope is that there's a giant team of people that are all out there rooting for your child and rooting for your family, but sometimes communication can be hard. And what you hear from one person, unfortunately, can also be contradictory of what you hear from another. And so just recognizing that this is hard and that as a family, your main job is to focus on advocating for your child and for yourself. And our job is to try to help you and be as clear as possible, right? We don't want to be clear as much. We want to be clear as possible with every team member. So let's look at what that definition of shared decision making is. It's that collaborative process between providers and patients, including the exchange of information and treatment options that take into account the patient and family needs, their beliefs, their values, goals, and preferences. Some disparities in shared decision making. So if you were to look at the white non-Hispanic families, they feel like when they are at a doctor's office and they're communicating with the medical provider, that, you know, about 85.8, so we'll round up to 86% feel like, yeah, we're a part of that. We participate in the decision making of what's going to happen for our child. If you look at English speaking families kind of in general, that was about 84% met the criteria for making some shared decision making. If we look at families that are non-white families and how that data changes, about 78% of Hispanic families met the criteria, saying, yeah, we feel like we get to, really participate and are equal partners in that shared decision making. Only 72% of American Indian or Alaska Natives met that criteria for shared decision making, and any other non-English speaking families were at 69% for meeting that criteria. Now, we know that 100% is not realistic. It is what we want. It is always the goal that um, parents and families and children in general are able to participate in shared decision making 100% of the time. Unfortunately, that's not realistic, but I think all of us would hope that all of these numbers, including the white, non-Hispanic, and Hispanic, and multiples, that every diverse family and non-diverse family would be at least 90% or higher, right? That's I feel like our top goal. And so hopefully as we continue with this presentation, you'll feel a little more confident and find some ways to bump up your number. The shared decision-making process supports conversations leading to better informed decisions that match what matters most to the patients, right? It is not about what matters most to a provider. It is what matters most to the patient and to that family. So some impacts of shared decision-making. It promotes bidirectional clinical communication. It improves parental knowledge and satisfaction. It leads to increased adherence to treatment plans, enhances patient engagement and empowerment, and leads to positive health outcomes. All of that to say, the more you know, the better it is, right? When we have more information, when you have been able to be a part of that team that created the treatment plan, you're going to have buy-in, right? If I didn't decide how this treatment was going to go, I don't know that I'm going to want to participate in it. But when you are able to advocate and say, yes, I'm a part of this. Yes, I agree with this, or no, this doesn't fit right. Yes, I like this part of it. I don't like that part of it. Whatever that looks like, when you get to participate, we're all better off. Your child is better off. You can feel more comfortable with the treatment plan. And as providers, they get to know, like, yeah, we did this together. And so the likeliness of it being adhered to as we had hoped for increases. So there are both patient and provider roles. Parents, patients, you are the expert about your child's unique needs and the holistic quality of life. Nobody knows your child better than you do. You guys are the ones that develop knowledge over time. You have learned what has worked, what has not, right? You've been with your child the longest. You will know, excuse me, whether a pill form will work, whether they need a liquid. You're going to know if expecting them to be able to sit and do an activity for 5 minutes is too long and they need a 3-minute activity, right? It doesn't matter what that looks like. You know your child best because you have that lived experience. And it is so important that you're able to share that with the clinicians and with medical providers because you know best and we're here to learn from you. Making sure that you're advocating for the care that you believe your child needs. And I know this is hard. I know that sometimes you might feel like a broken record. Sometimes you might feel like it is so exhausting to continue to request something when you just have this gut feeling, or to bring your child into the doctor and be told it's an ear infection. No, it's this, it's that. And then to trust your gut and continue to go back to the ER and to find out, no, I was right. They have an infection or they have whatever this is. That is tiring, both physically and emotionally, but you are the one who knows the care that they need. And so just keep doing that because it definitely, I don't say definitely, it pays for you to trust your gut. And I would say that probably 100% of the time you will know. And to know what is feasible and reasonable regarding a treatment plan. If someone is like, your child needs, we'll use ABA for an example, 10 hours of ABA a week. If you have multiple children, you have to drive an hour for services. If you have a full-time job and we'll have to pick them up from, we'll say daycare or from school, bring them to a treatment place, drop them off for a few hours, then go back and pick them up, that might not be feasible. And we as providers aren't going to know that. So it's so important that you feel comfortable saying, listen, I appreciate that you're telling me this, but that's not going to work for me. And just because you know your family dynamic and the needs that your family has. Providers and doctors are familiar with conditions and treatment options. We do not have all the answers. No providers have all the answers, but we know what we know as well. Our job is to clearly convey information without bias. So that means that we're going to try to set you up for success by saying these are all of the benefits, but these are also some of the burdens that come with that, right? I'll use ABA again as an example. It's great. We can work on treating more skills. We can work on reducing maybe behaviors that are hard or troubling, but it is a lot of time. It might be a lot of time in the car. It might be a lot of time out of school, right? That's an honest thing. And so our job is to really make sure that we are as honest as possible with both sides of the treatment. Providers are meant to provide opportunities for parent engagement. We ask questions, we want to know. Sometimes I know it can be intimidating sharing. And so providers are really meant to kind of ask in ways that feel comfortable for you so that you feel comfortable sharing. We assess and clarify misunderstandings if something didn't quite make sense. I know I tend to be talking to families and writing notes, and sometimes I miss things. And so just making sure to double check and clarify that to make sure that we're all on the same page, and ensuring that a treatment plan is agreed upon and implemented with fidelity, that we're all on the same page as to what that treatment plan looks like and how that's going to be implemented. Are there any questions so far? No? Okay. So let's talk about addressing barriers. We have 3 types of barriers that we're going to talk about today. System level barriers. We know that the system has its flaws, and sometimes we can work on that. Sometimes we can work around it. And so we will address some of those just on cultural awareness and cultural curiosity in general, and then patient values. So these are 2 types of frameworks. So in 1983, there was very much the medical model for providers, saying that we need to listen with empathy. We need to explain the perception of the problem. We're going to acknowledge and discuss differences and similarities. We recommend treatment and we negotiate on an agreement. Not wrong, but times have changed, right? And that is not something, the LEARN model does not include collaboration. The SLATE models, however, does include collaboration. So this is something that is really for families and as providers that we should be aiming for. We want families to share personal values, treatment goals, and cultural considerations. If there are certain, whether it's foods or activities, that you really are advocating for, that you want to include, that we need to know, please share that. Listen to providers' information and possible outcomes. You know best, and I think it's important to just remember that both sides need to listen and just be an active listener and be willing to kind of learn from each other. Assess comfort, resources, and limitations around treatment plans. Again, what's feasible, what isn't, what feels like I can do this, and what feels like, oh, I don't really know, what is this for? Making sure you're asking those questions. Talk with the providers and reach a mutual decision, and then execute the care plan. Next, we're going to talk about systems. So this is a quote that came from a family that we had interviewed. They talked about the lack of consistency in information and the lack of information shared among providers. In some cases, one provider would make one area of need sound high and a priority, and another provider would belittle that same topic, even having influence. It felt hard to filter the variations in perspectives to know what course of action would be best for the child, right? I feel like that's probably pretty common in a lot of families, getting mixed information. And the thing of it is, no one is wrong, right? One provider saying working on this is an important thing is not wrong when another provider says something else is important. Neither are wrong, but guess what? Providers don't have the final say. It's meant to be a shared decision. Families, you can say, as a provider, I could say, I think working on using utensils is really important. And if a family's like, we don't really use utensils, we eat mainly with our hands, or we use bread or tortillas or whatever, that's what matters. My idea gets vetoed, right? Like that's not what matters for you culturally. And so making sure that you are sharing all of that information. So barriers to shared decision making. So if we talk just about the systems, time and frequency between provider and patients. Sometimes appointments are set up to be 15, 20 minutes. That's not a lot of time. One of the things to do is to just advocate and say, I'd like an appointment to be, to be able to be 30 minutes instead of 15 minutes if you have a lot of questions. But it's a barrier. And sometimes we can do something about that. And sometimes it takes that advocacy. Being able to communicate between systems of care. I know in North Dakota, it's a really hard thing to have different systems and different areas talk to each other. So I'm going to assume that the same thing is true in Utah. What happens in maybe a therapy office is not always shared in a consistency at a medical office, which is then not always shared to your speech therapist or whatever, right? So just being able to communicate between all of those different therapies and systems. Quality medical interpretation, whether that's online or in person, that is hard to come across. Adequate time for appointments. We kind of talked about that, about making sure that there's enough time to address all the concerns. Adequate transportation. There are a lot of families that live far away from care, or that it is not just a quick trip to get places. Many families that live in rural areas, especially, or even if you live in a city, it might take an hour or 45 minutes to get across town, or to get sometimes even longer to get places. If I'm asking you to come to therapy session 3 times a week, and that's an hour drive plus an hour drive home, is that realistic? And also, some of those are barriers. And childcare. It is very hard for families to be able to sit and engage with providers if they also have other children that they're trying to care for while listening to the medical provider about their specific child that the appointment is for. And it's hard. I get it. And I'm not trying to say that this is by in any means anyone's fault. It is just a reality that sometimes the other kids are there, and it's hard to listen and focus when we're also making sure that the other kids are okay. Any questions around system barriers? Okay, go to the next one. Again, just a reminder of what our frameworks are. We're really thinking about that SLATE model: sharing, listening, assessing, talking, and execute. So we're going to talk about cultural awareness next. Another quote from a family. Excuse me. I'm hoping the intent comes through, as this was conducted in Spanish. So I'm hoping not to lose things in translation literally, right? When you have a provider that maybe does not speak the same language that you do, it is very difficult to make sure that whatever the questions or comments are coming through the way that you'd hoped, whether it's through the translator, whether it's through a family member, or whether it's you and the provider trying to make it work. Things can get lost in translation. Heck, things get lost in translation sometimes when it's the same language, right? Like that's a common thing, but it's even harder when it's a medical issue that you're talking to and a provider, and there's that barrier. So we want to make sure that we are able to have clear communication. knowing the patient or family's preferred language or preferred communication method. Do you prefer things written? Do you prefer verbal? Do you need pictures for certain things that are appropriate to have photos for? What way do you learn best? Then a lack of cultural knowledge in patients' native language. So making sure that we're able to access materials that are in your preferred language, that you are able to understand, to read through, to look through, so that you are able to make those decisions and have all of the information. Verbal and nonverbal cues. This is something that, with every culture is a little bit different, and every family, right? So, for instance, I work with a lot of families that are from the reservation, and eye contact is not a big thing. Like, we will look and kind of glance at each other, but it's not something that I have learned to not expect for constant eye contact. That makes most of my families uncomfortable, and it would also make me a little uncomfortable. So I get it. But learning how to read those cues with other people and to what makes them feel comfortable and what those mean, being aware of our conscious and unconscious bias. We all have it. As a provider, I have it. As a human being, I know that I have some conscious and unconscious biases that I'm working on, and making sure whether it's a family member, if it can be something that simple as like doctors are always cold. Maybe, maybe your learning history has shown that doctors are cold, but maybe that next doctor you go to, maybe that won't be the case. And so we just want to really keep an open mind in knowing that just because we've had these past experiences being one thing, it doesn't mean that that's how that next experience is going to go. And just kind of being open and aware of those biases. And then there are power dynamics. We think culturally, family, socioeconomic. Many cultures, diverse patients will defer to the provider. If you feel like, well, that's the doctor's area, or that's the medical provider's area, they know best. Maybe they might know the treatment best. They might have worked with 100 kids that have epilepsy, but they've not worked with your child yet, right? You still know your child best. And so just being aware and feeling comfortable to say, you know what, they have a lot of expertise and they know things, but so do I. I'm mom, I'm aunt, I'm grandma, I'm whoever, that your information that you need to share matters to. And cultural customs and practices. There are certain rituals and things that you might do to cleanse your spaces or to um, help get rid of, we'll say, fevers or whatever that might be. And it's important that you share those with the doctor or with the provider so that they're aware of that. Um, by no means do we want you to share things that feel uncomfortable, but things that you feel comfortable with that you think are important and pertinent for your child. Make sure that you share that so that we are aware. When we talk about the power imbalances, patients do have the skills and abilities to be included in decisions about their own or their child's care, right? Just because your child is nonverbal or non-focal, or if your child is only 3 or 4, they can still have some ownership in some of those decisions, right? Maybe it's, do you want your medicine to taste like grape or bubble gum, right? It's not a big decision, but they get to have some ownership and get to kind of help um, to be in a part of that decision making as for their medicine or for their treatment. Some cultures tend to defer to authority. As doctors, we really want you to feel like you can share questions or concerns without being um, fearful of judgment, like you're going to be wrong or you're belittled. This is a team effort and questions are encouraged. If I don't ask questions as a provider, I'm never going to know about your family. I'm not going to know about your awesome person that you have that we're working with, your child. Um, it's meant to be a two-way street. So make sure that you are feeling confident in being able to share those things. And it's hard. Parents, families, I know that's hard. But we will talk about some strategies to maybe help you feel a little bit more comfortable. Some cultures tend to defer to authority within their family. So recognizing that sometimes a matriarch might be the head of household, or it could be, grandparents, grandfathers, it might be the dad, whoever it is that makes those decisions. And as providers, it's important that providers know who that is. As much as we want to make it shared, as much as we want that patient to also be able to be a part of that conversation, we also know, and we want to respect the fact that sometimes people other than just mom or dad will make some of those decisions or will have a say in some of those decisions. And it is not for a provider to judge how that looks or what that is just our job to support and to provide information and to come up with a treatment plan that everyone feels comfortable with. So what is the child's role? There are cultural implications of asking the child instead of the authority figure. Maybe, right? Some families don't feel comfortable having the child participate in their medical decisions. I might feel like letting them choose their type of med, whether it's grape or bubblegum, isn't a big deal. For some families, that might feel like it's a huge deal, and we don't want them to have that choice. And that's okay, right? If you don't want to let them do that, that is okay. But I just want you to feel confident in knowing that it's okay, even if you have a little person, that they can make some of those decisions. And what is it? Can it be something as simple as, do you want to sit on the chair or do you want to sit on mom's lap? Right? Pretty simple option. But any of those little things that you can kind of help them feel a little more in control, because going to the doctor, going into therapy can be really big and scary, and we want to make them feel as comfortable as possible. And then thinking about, is the family working on a shared decision making with the child or youth as an active participant in their treatment? So again, if you're not sure, if I want my child to be a part of this, but I don't know how. What can I do? You can ask those questions. Um, and if you don't feel comfortable in having them be a part of it, that's okay. But maybe it's something to think about at home. Of, okay, I don't want them to participate in some of these decisions at the doctor's office. I would like a little more control. I'd like to be able to decide what that environment looks like and what those answers are. Are there ways that you can talk with your child at home before you come to the doctor or after you come, so that you can do that in the privacy of your own home? If that's what feels comfortable for you, then that's okay. You can do that too. So here are just some question prompts that we can talk about. Providers, we really want to use plain language, avoiding all the complex medical jargon and terminology. We really want to make sure that we're holding space, that we're asking questions of all families, that if you need things repeated because you are getting bombarded with information at appointments, right? Some of it can be good, some of it can be bad, some of it can be just plain overwhelming. You've got all this information thrown at you. If you're like, hold on, I need a minute, that's okay. Our job is to give you that minute to process and then continue to ask some questions. So again, we're looking at asking open-ended questions, trying to see, like, do you understand? Do you need a little more clarity? Do you need another minute? And then what those next discussion steps could look like. What do we need to talk about next? What do we need to do next? Patients and families, make sure that you can share with the provider what is important to your family around treatment outcomes, whether that's time, whether that's, medication, whatever that looks like. What is important for you that you want us to know? How are the options that we've suggested? So if I suggest 10 hours of ABA, how does that fit or not fit with your family's cultural values? Whether that's a time issue, whether it's we're not sure we understand what that is, we don't know that we believe in this, or whatever, that is all okay. All questions are valid. Please know that all questions are valid. And so it's your job to just really make sure that you're asking all of those, and it's okay to question. It's okay to question me or any other provider, because you're following your instinct and you want to make sure that you feel comfortable. Talk about any barriers or challenges or concerns that you can foresee. So again, if it's travel, if it's childcare, if it's a money thing, because sometimes, and unfortunately, money can be a barrier, right? It's expensive to have a lot of healthcare concerns. What are the options out there? And then pros and cons of the treatment options with your family's life. So again, if you have multiple children and I'm asking you to bring your child an hour away for an hour-long appointment and drive an hour back, is that feasible? If it's not, okay, let's talk about that. Really thinking about as a whole, right? Because it's not just about the patient and it's not just about the parent, but it's your family as a whole. How can we try our best to provide options that work with both the patient's needs and for your family? That doesn't mean we get it right every time, but it means that it's an open conversation. Are there any questions around cultural awareness? No?
I'll just make a quick
Yeah.
comment. I think it's really important what you were talking about with the time. And I just, from my limited experience of helping, someone who not only are the parents there, but then if there's a language barrier, then you have an interpreter, and then taking the time for like the family to be able to ask questions through the interpreter to the whoever it is provider, and then they relay that back. It just takes so much time. And so I appreciate all the empowerment that you were giving in that section. And I hope, I feel like that would be a hard thing to do, but I mean, it sounded like the recommendation is, if you are aware that you're going to need more time to talk it through with the doctor, ask for that.
Yeah,
don't
absolutely.
don't like try to get your 10 minutes with the doctor to get all your answers, because it's not going to work. Like, ask for more time, and that's okay, and that's what you should do.
Absolutely. And if unfortunately you get told the doctor only has 20 minutes today, it's okay to say, okay, then I need to schedule a second appointment. Because you want to make sure that all of your questions are answered and that you feel comfortable. And if that means 2 appointments, or if that means, can we set up a time to have a Zoom call or an audio or like a telephone call or whatever that looks like that fits best. Like, it's okay to request all of those different things to make sure that it can work best for you.
Yeah,
Absolutely.
that's so important. Thank you.
Mhm.
I have a question
Our
as
next-
well. Um, you know, uh, it is so important the information that you are sharing, Jessie, and I know that a lot of work was invested to put this information together. But my question is based on your experience, after you are making all those efforts to approach the system level barriers, the cultural awareness barriers, but are there any indicators based on your experience that we need to follow up, that we are being effective in breaking those barriers? Just to give you an example of what I'm trying to ask, there was a need assessment that we were asking to providers of mental health for people with disabilities. What are the main barriers that they have in their practices? And they put it at the top, communication as one of the main barriers. But when we asked to the self-advocates or the family members of people with disabilities, what are the main barriers for them, they put it communication at the lower level. So it seemed like families, they thought that they were communicating very well with the providers, but the providers, they were not in the same page. They were thinking that that communication was not effective. So, what are some indicators based on your experience that you think we need to pay attention as providers that we are breaking those barriers?
Well, that's a good question. I guess based on my experience, it's a lot of buy-in for treatments, right? Like, parents or families are willing, or even the client are really willing to participate and do the activities or the treatments as we've agreed upon if they have that buy-in. And I feel like buy-in comes when our communication is clear. Like if the treatment is being completed with fidelity, and if you're feeling like there's success and growth is being made, whether it's uphill or downhill, depending on what you're looking for, that's a huge one. Uh, I've also gone through, and as we go through the slides and on the resources, there's a variety of picture communication and some other options that are available. And I've asked families, like, do having these pictures, does that help? Is I send out the information ahead of time before we meet. Just like I will just ask, like, what works for you? And I found that a lot of parents or families are very open to say, yes, that works, or to be honest, I don't look at it. You can send it a week ahead of time and I still don't have a chance to look at it. But, okay, cool. Like that's all right. And so it's just kind of that honesty in what's working and what isn't. But the biggest thing that we really look for is that treatment fidelity and what kind of data we're able to get from home to community based to like clinic services. Looking, are we all on the same page? Are we all seeing that things are working or not working? And finding where are the holes? Where is it that we're miscommunicating, or where is the fidelity lacking?
Thank you, Jessie.
So the next part that we're going to talk about is patient values. So again, just another family quote. During the process, we had to anticipate reactions and illnesses. So much of our life has been on hold. Childcare is not safe for our children, and we have had to change our employment strategies to accommodate our family's new needs. So being aware that there are many times where families might have to give up their jobs or try to find jobs that allow them to have more flexibility, whether that's working from home or working, night shifts when another parent or family member can be with their child. Maybe that's working weekends or whatever that is. And just really being aware that um, what we see in a clinic or in a therapy setting is a very small snapshot of all of the life events that families change to make sure that they can provide for their child. So if we're thinking about those barriers for patient values, not knowing a family's cultural or spiritual values and the impact on healthcare decisions. Not recognizing what the family brings to the treatment setting, right? If a provider isn't recognizing what values you have and what things matter most to you, we also aren't recognizing the value that you bring as a family member and that you do know your child best. Not understanding how time and financial obligations affect treatment options and feasibility, right? We need to understand that you don't maybe have the time. Sometimes we don't have the money. Sometimes not right now, right? It doesn't mean never. It means right now I am too overloaded. I'm too overwhelmed. I can't think about this right now. I need a minute. We need to come back to this conversation. If I don't realize that as a provider, I'm going to keep overloading you, and that's not helpful either. Um, and not knowing what matters to the family. What are your main concerns? Again, if I'm just going to use ABA because that's the field that I'm in. Again, so we're going to pretend that I think utensil usage is an important goal. If that doesn't matter to you, we're not going to do it. I might think like, oh, we really need to work on toilet training. Maybe that's not an important thing for you. Maybe your concern is that you can't walk into the grocery store without your child running. Yeah, that's a safety concern. That's a big deal. We need to make sure that your child is able to be safe. Whatever that might look like, but just making sure that providers are aware of what your concerns are and what your goals are in this treatment. Is your goal to help them live an active life? Is it to just help them to learn how to have a communication device? So what does that goal look? Do your goals differ from medical treatment goals, right? Is a therapy goal different than what the doctor is working on versus what the school is maybe working on? And then thinking about those power imbalances. Are you feeling empowered and able to share that information? Do you feel like you have to listen to the teacher or to the doctor or to the therapist? Do you feel like you can say what feels comfortable for you, what doesn't, what things that you want to advocate for your child? And then the patient's level of knowledge and understanding. Is information being presented in plain language? Am I going to talk to you about, we'll say, and I'll use this example because this was my mistake earlier. When talking with Eduardo, I talked about the treatment fidelity. That's we'll call it a specific like medical terminology, right? Treatment fidelity just means, did the treatment get followed as we planned, right? If the child was meant to work on saying the letter R 3 times before bed every night, did that happen? Or did they only work on it twice? Did they work on B's and not R's because there was a communication imbalance, right? So it's just making sure that instead of using terms that maybe aren't familiar with parents or that isn't everyday language, I'm going to make sure that I explain it in a way that makes sense. Treatment fidelity means, did we follow the treatment as we planned? So that was my mistake. I apologize. We don't always get it right, but we can apologize for the mistakes that we make, right? Here are some question prompts. So providers, make sure to ask the family to share their understanding of their child's condition, making sure that we're asking what this means from their cultural or spiritual perspective, asking questions that are relevant to customs or practices that might influence the treatment options. Again, whether that's spiritual, it's dietary, any other cultural practices that you might have. And patient and family, talk with the provider, ask them to explain all of those treatment options, the good and the bad, the pros and the cons. If you don't feel comfortable with the treatment options, ask about other ones, right? Like, again, so when we use ABA, if you aren't able to make 10 hours work, can you ask for less hours? Yeah. Can you ask, is telehealth an option so we can do it from home instead of having to come an additional hour out of the way? Maybe, right? You ask for what are some other options? Are there places that I can do the same treatment closer to home so I don't have to come an hour? Excuse me, maybe. Let's ask. Let's find out. Share your concerns or limitations around treatment options and barriers you foresee, right? Make sure that you're being honest and letting us know, and share your expectations and rationale for treatment decisions. If in your gut something doesn't feel right, or you're like, I just don't know, tell us that. You know your child best. And I know I've said like a broken record, but I will keep repeating it because it is true. Your job as a parent, as a guardian, is hard. There is a more complicated words to describe that, but it's hard. It really is. It's exhausting and frustrating and hard. And making sure that you are clear and advocating, and that you are able to say, you know what, I don't agree with this, and this is why. Then you probably have a better chance of getting the medical provider to be like, oh, okay, that makes sense, right? Because sometimes we miss things. We're all human. Um, and just as you are learning and growing and learning with your child, every time we have a new clinic patient, whether we have a new learner, whether we have a new child that we are working with, and every family we work with, we are hoping that we are learning and growing and learning how to be a better support for the next family. Some families, we get it right, and some families leave and like, that didn't go very well. How can I do better next time? Right. And so making sure that you're also sharing all of that information, it helps us all to become better. It helps you to advocate for your child better, and it helps providers learn how they can be better the next time for the next family. So here are some communication strategies. And I love this quote. I'm just going to share real quick. The greatest problem with communication is the illusion that it has occurred. Right? Sometimes we think that we are very clear in our communication. Other people might view it as being clear as mud. So making sure that we are communicating in a way that is effective for both parties. Again, talking about using qualified medical interpreters. I know that sometimes we like to use our family or friends or other siblings that speak English or whatever that primary language might be, but really knowing that sometimes that qualified medical interpreter can break down some of those jargons and some of that medical terminology that is a little bit harder to just explain. They can typically do a better job of that and make sure that nothing is missed. Um, Using plain language, right? Avoiding information overload. If you are getting a lot thrown at you, that is overwhelming and you are not soaking in information, right? I know at the end of this, I would probably be like, whoa, I'm good. But making sure that you're saying if you need a minute to stop and think, encourage questions and use open-minded phrases, um, using a teach back. So that just means going back and asking, I don't, do this what this means? So you're just kind of repeating what you heard to make sure that you're confirming it and that that is what it was. Sharing credible online resources, right? Don't WebMD everything. That's not always a good plan, but making sure that you're asking for credible online options for resources and knowing that every culture has different communication styles, whether that's direct communication or indirect communication. And this is just another quote. I would have liked to have been told what each option should be considered. We were told the risks associated and why different treatment options, but not why we might want to pick the different options as it pertains to our child's specific diagnosis and severity. And again, that's really something that it's a provider's job to make sure that we are telling you all of the options and what what might be beneficial. You are still going to know best, but we can always give a recommendation. And then some decision aids. We like to provide information about options associated with the benefits and the harm that might come, help clarify any differences between decisions and the personal values and the treatment plan options, reducing the portions of undecided so participants, we want to make sure that we are as clear as we can be, that you know what to expect when you come into the treatment plan or into those meetings. We don't want you to be scared off by anything, making sure that you're as prepared as can be, and having that positive effect on that patient communication. People who are exposed to decision aids feel more knowledgeable, they feel better informed, they're more clear about what their values are, they have a more active role in decision making, and are able to state an increased accurate risk perceptions. So we do have a variety of decision aids that will come with this webinar that you will get in an email. Please reach out, and if you have any questions, there are a variety of pictures and websites and links that really help kind of give some guidance on decision aids. So we're almost done, I promise. Discussing treatment goals. It is a constant circle, right? It is always evolving. We are understanding the family's treatment goals and choices, encouraging an expression of concerns, making sure that you're asking questions. Again, learning about barriers around time and resources and needs and systems and policies. And there are things that we can work on, even if it's just small little changes. Exploring preferences, exploring what feels best to you and what feels best for your child, working through steps that the family must follow to achieve those treatment goals, and understanding the preferences, needs, and goals can change over time, right? Your goal might be that your child is able to be potty trained. Yay, we did it. Guess what? That's not the one and only goal. There's going to be something else that is going to come along. And just knowing that these things are constantly evolving and changing, and that is totally expected. So next steps, when you go into your next appointment for your child, I would really love it if you can just think of one thing that you can do to help kind of build that communication gap. Is it one thing that you want to make sure that you share with that provider, whether it's around a goal or a barrier, whatever that might be? Share the best techniques and practices with other professionals and families. If you're like, hey, this has worked really well for our family, share that information. I know because it works well for family A does not mean that's always going to work well for family B. But the more we know, the better that we can make some of those decisions. Be mindful about system barriers, cultural awareness, and patient values. We don't always get it right, but we can try. I mean, making sure that we are just acknowledging that there are lots of barriers in place and we are all doing our best. Providers really making sure that we're reflecting on our practice and how can we improve. And families making sure that you feel comfortable being clear on the goals that you have, those values that you and your specific family unit hold dear, and the treatment outcomes. What is it that you want out of this? What are your long-term goals and how can providers help? Know your limitations and share those with providers. Any last questions? You guys have been awesome. I've taken a lot of your time and I'm sorry, but I hope you found this helpful and useful in your as you go to your next appointment with providers. Thank you so much.
You
Any other?
haven't taken more time than needed because we started late. So you're awesome. You're so good. This has been so good.
Perfect. Thank you so much. I'm going to stop sharing.
Do you want to quickly go over some of those resources before we
Yeah,
finish up?
if you're okay with that, I would love to.
Yeah, let's do it. I'll share my screen.
Okay. So this first one are just some prompts for parents as you're going to the doctor's office or to the therapist office. And just some ways to kind of understanding your diagnosis. You by no means have to use all of these questions, but if there's some questions that maybe you didn't think of, please go ahead and look through this. There's understanding the diagnosis, treatment option questions, some timelines. I think that timeline one is really important to know once you've had your child assessed, how long until I find more information out? When does treatment actually start? What does that look like? And then asking questions about the quality of life, right? How is that going to affect your child? Financial considerations. Are these treatments things that are covered by insurance? Is it only, excuse me, certain insurances? And then what are some other resources and support in your area that you can reach out to as needed? The second one is on shared decision making. This is just, again, kind of a checklist for patients. So this could be one of the things you think about when we think about what's the one thing that we can do before we go to our next appointment. Is just writing down what matters to you, whether it's on a piece of paper, a note in your phone, whatever works for you. Here's just some ideas of how to be prepared before your appointment. Again, some ideas of during your appointment, what are some questions that you could ask? I know in appointments for myself personally, sometimes I get a little flustered. As a provider, I should be able to do this, right? But I do, I get a little flustered during things. And so I like having some of these question prompts, just like, oh yeah, I was going to ask about this, just as reminders for myself.
I think that's so good. I always have to have a list of my questions when I go to the doctor because I get too busy just chatting, and then I oh yeah, I had 12 questions that I wanted to ask about different things.
Right. And then just kind of after the appointment, what are some things that you can do, making sure that you keep your notes in a place so you can reference them later. If you're not clear, asking questions. And like we had kind of talked about, ask for more time, whether it's a follow-up appointment, whether it's more time during that appointment. If you know I've got 20 minutes and 30 questions, something's not going to line up, right? So making sure that you advocate for extra time is needed. And be your best advocate. So this next is just, again, kind of that slate model, just to kind of keep in the back of your mind, or for providers to have in their office as a prompt for themselves to make sure that we're thinking about families. And then these are just some 5 stages of advocating, coming prepared, prioritizing certain questions and concerns. You might have 20 questions, but what are the top 5 that you really feel like you need answered right away? Sometimes it's nice just to bring someone that you trust with you, right? Whether it's someone who has gone through this process, whether it's just a trusted friend, just having that support system we know is huge for children and families with special healthcare needs. But it's important for you, right? It's
Mm.
not only a support system for your child, but it's for you to know that I'm good, right? I've got this, and there's nothing wrong with that. Please do that. And asking for requests to be documented in your chart, right? There's this little quote that says, if it document or it didn't happen. So we want to make sure that we are documenting all of the questions so that we can refer back to those as later. And then don't be afraid to get a second opinion, right? You might not like what you hear the first time, or it might feel uncomfortable. You're like, oh, this just didn't sit right with me. Ask for a second opinion. I don't think there's anything wrong with that. I know very few people that would say don't do that, even if it's a second opinion from a medical doctor, from a speech pathologist, from whoever. Please just, that's okay to ask for another person's opinion. And then as we go down, there are a variety of social stories, or social narratives, just about what it's like. So if you were to use the QR code, it will pop up what it's like to go to the doctor or being in the hospital, what to expect if you're getting your temperature taken. So just a variety of kind of common medical ones.
Mhm.
They're all free to access. If you like to print and laminate, you can do that. Or if you just want to look on your phone, that's always an option.
Mhm.
Again, these are just kind of some PECS pictures, visuals. I work with a lot of kids that pictures definitely work a little better, so they know what's coming and are able to kind of be a little more prepared. What happens at a doctor, some comfort positions, how to make your child feel a little more at ease when at the doctor. And again, if we're thinking of how can the patient advocate and the patient be a part of it, how do you feel? What's wrong? Where does your where does it hurt? At your stomach? What do you need? A drink of water, right? Just finding other ways that they can communicate that as needed. And then the QR code again is just more visual supports. There are so many free, great visual supports out there. Please go and check them out and print and use as needed.
That is so awesome. Thank you for sharing that. I did not know that this was in the works too, as with the presentation. I think it's so, so awesome.
This could have probably been a little mini presentation itself on all of the things.
Yeah,
Probably.
yeah.
Oh, perfect. Well, thank you so much for letting me share our team's work. It really was a group effort, and I'm so happy I was able to sit here and share all of this great information with you and families. I hope you feel like this has been useful and you feel a little more empowered for your next visit.